Ending Obamacare was a central promise for Donald Trump when he was the candidate. As the political machinery grinds away in Washington, we journeyed through Kentucky to meet some red state voters who say Obamacare saves lives, and they want to know what happens next. Here's ABC's Gloria Riviera.
It's the home of bluegrass, where the bourbon flows freely and the horses run fast. Kentucky, known for its deep red politics and now surprisingly the success of Obamacare.
We wanted to come here because it has been held up as a state that's an example of how big an impact the Affordable Care Act has made.
People like Leah Bremer.
In our family picture, that's the one. Leah may not be here next year picture. That was not a good Christmas.
In 2015, this widowed mother of two was diagnosed with stage 4 breast cancer.
I had about 2 or 3 weeks to live.
But Leah was given a renewed chance at life, thanks, she says, to her coverage under the Affordable Care Act.
Here we are.
That allowed her to receive an innovative but expensive treatment, nearly $40,000 a month.
If I didn't have health insurance, I wouldn't be alive.
Now Leah is worried that her life hangs in the balance as she and 20 million other Americans insured under the act await a plan from Washington.
Obamacare has failed.
Where the drumbeat for repeal has grown louder.
America's Obamacare nightmare is about to end.
But here in Kentucky, there's been a startling drop in the uninsured rate since the law was passed. Some areas even going from 20% to less than 10% uninsured.
We are on the way to Whitesburg, Kentucky. This is a rural part of the state, and it is not uncommon to find people who struggle with diabetes, obesity, cancer. It's also not uncommon to find people who are getting their health care through Obamacare and don't know what the future holds.
Nestled in the Appalachian Mountains, this is a town steeped in a proud tradition of hard work, perseverance, and coal mining.
Around here, you keep a job because you got to work to survive.
But Mike Taylor says his 12 years as a coal truck driver are also at the root of his health troubles. In 2015, Mike was diagnosed with black lung, a deadly disease caused by breathing in coal dust.
You're on 3 different inhalers.
Now he's able to come to this community clinic where his old high school classmate, Dr. Van Breeding, gives him life-saving treatments.
Feel like a new person.
Mike is one of the nearly 500,000 Kentuckians who benefited from the expansion of Medicaid under Obamacare.
Now, is this the first time you've ever had regular inhalers to use every day?
Something Dr. Breeding believes is crucial to the health of his community.
These people need care. I'm from here. I grew up here. My father's a coal miner. I know the disease he suffered. I take care of classmates of mine every day who are disabled now, who can't work, who are wore out. These are the people that have been helped by the Affordable Care Act, and these are people we can't turn our backs on.
Even though Mike Taylor is one of the Trump faithful,
Thank you. Y'all take care.
he says he knows what Obamacare has done for him.
Saved my life.
You're worried. Yeah. What's worrying you?
If they do away with this, the insurance, they need to, I think, just need to reform it.
Reform, not repeal. A chorus sung by many Trump supporters here, people like Kathy Aller.
I thought he was looking to repeal it to make it better. I don't know what's going to happen now. Do you ever have people that need health insurance?
An unlikely evangelist for Obamacare, she says that she has signed up more than 1,000 people in the last 3.5 years working for healthcare.gov.
Hi. Have you have any health insurance? I'm signing people up. I like helping people and seeing the joy on their faces when they get affordable insurance.
In January, we caught up with her on the very last day of open enrollment.
We go back to healthcare.gov.
Kathy sits down to enroll Danny Locke, who says he hasn't had insurance for many years and credits simple luck for staying out of the hospital.
Do you have Social Security?
I got full medical disability, which is, I guess, Social Security.
But at the end of the application process,
Are you ready?
they are greeted by an unwelcome surprise.
Oh dear. If you went the cheapest of health insurance, this is the price it would be.
Nobody can afford that. That's
Right.
almost $400 a month.
For Danny, like many Americans, Obamacare's premiums are simply too expensive.
I see your face all the time because it is unaffordable. I'm sorry. His whole life he's always had insurance through employment, and he's not able to afford signing up on coverage, and that really hurts my heart.
The high cost, one of the reasons Kentucky's current governor, Matt Bevin, has become one of Obamacare's most vocal critics.
I thought it was a disaster from the beginning, no question. One size does not fit all in anything, certainly not in something that is as critical as health care.
Bevin's main argument echoes the voices of many Republicans, that health care should be handled at the local level, without mandates from Washington, like requiring everyone to have insurance.
Let's say you're a single parent and you're making $30,000 a year, and you're required to have health care coverage now under the Affordable Care Act. Do you really think that you can afford to pay $6,000 in after-tax dollars for your health care for you and your family? No.
How do you reconcile the fact that nearly 500,000 more Kentuckians have health insurance under the ACA?
Simply having health insurance does not make you healthier. If you have a Medicaid card, but you can't find a doctor that will see you, how does that Medicaid card help you? You can't eat it. It's not vitamins. I'm being a little facetious, but truth be told, a piece of plastic doesn't make you healthier.
Bevin's hoping that if Obamacare is repealed, he will be able to transition people off of Medicaid. His controversial proposal includes copays and premiums and would require more people to work for their benefits.
What do you say to people who have so many questions right now and who are truly afraid?
There's a lot of fear that's ungrounded in reality. There's nobody in America that I'm aware of, certainly no governor, Republican or Democrat, certainly nobody in the federal administration at the congressional level that I know of, that is looking to make people less able to avail themselves of the healthcare system.
So we have to communicate that to them so we get covered.
But Dr. Breeding is worried that what Bevin and others are proposing may in fact put up more barriers for people that are already struggling.
We're seeing that it's a political war over health care, and the collateral damage is the patient's health and life and the quality of life.
This was the Thanksgiving this past year.
While the fight rages on in Washington, around the country, people like Leah Bremer must wait for a full picture of what's to come next.
Of course, I worry about if my cancer were to come back, what would happen? But now I have to add to that, what would happen if I lose my health insurance? I need to be here for my daughter, help her get through college, see my grandchildren being born.
For Nightline, I'm Gloria Riviera in Kentucky.
Our thanks to Gloria for that report. Tomorrow night, ABC News is going to carry the president's address to Congress and the nation live at 9 Eastern.